Hi, welcome to today's educational session on how to become a residential care provider for individuals who have special needs, especially focused on intellectual and developmental disabilities. Hi, I'm Marty Hannon. I work with Centerpoint Support Living, and we provide services for individuals who have special needs, primarily working with those who are part of the developmental disability or DD waiver under Medicaid. Uh, we I'm a recreational therapist, so my background is a wide range working with individuals who have a variety of special needs. Stay in call. Uh-oh. I think that I need to adjust something. Excuse me one moment. Okay, let's get back on track. So Google Meets was giving me a little bit of an issue there, but we're good now. So I am so pleased that you are going to be watching this on the recording. So I wanted to share information on how to support an individual with special needs and in the resources that are out there. So Centerpoint Support Living has been in the Denver Tri-County region for the past almost 10 years now, since 2015. And they we have been providing support services that help align individuals in getting paid by Medicare to be a care provider. Now, we also provide day programming services along with coaching for employment preparation, and we help those individuals get the support they need. We are a provider approved support agent service agency, sorry, or also known as a PASA. Now, many of you have family members who have been diagnosed with an intellectual or developmental disability. And these are a few tips on how to get you started in thinking about becoming their care provider. Now, if somebody is young and has received a diagnosis, many times they will start the process to get on the DD, the developmental disability waiver through Medicaid. They'll get on the wait list at a young age. It doesn't kick in until that person turns 18, but it can be a long wait list, and it can take a couple years to get through the whole process to get on those to get even on the wait list. So we encourage people to start as early as they can. Now, again, how you get started is you go to your doctor and you seek a treatment team to be able to get evaluated for what level of need or service this person requires. So they're going to do a full evaluation. They're going to attach a service number to the person. So it could be from 1 to 7, 1 being very light care needed. So and light supervision needed, but they may have intellectual and developmental disabilities like autism, Down syndrome, cerebral palsy. But they can be pretty high functioning with those disabilities. They just need some supervision and support to make sure that they're safe and making proper judgment. So the treatment team will decide that. We'll go through a battery of tests with you. You will then get connected to a case management organization. In the Tri-County region, it is Developmental Pathways. They're fantastic. That case manager will work with you on letting you know when you have moved off the wait list and ready to get services. Now, Douglas County just released over 900 people more to receive services last year. And each year they allow in a certain amount of new people to be able to get support. again, the people who are released onto the wait list depends on their severity and how long they've been waiting. So if somebody has a high severity, so one we talked about was very high functioning, they're probably working a job, they can be alone for a couple hours in the evenings. But then you can go all the way to the extreme of having co-occurring disabilities, such as a person who has cerebral palsy, and which is more medical developmental, and then they have also that their medical needs are very intense. So some people need feeding tubes, they need 24/7 care where they're bedridden or just have to be in specialty chairs. It's very difficult to transport. Maybe they have behavioral issues with autism that are pretty severe. So those people can be ranged from 1 to 7, depending on how complex their care is and what will be needed to support them. The funding comes in place depending on that severity level as well, and how much the government and the Medicaid is willing to cover for their expenses to pay care providers and treatment teams. Now there are different types of waivers you can get, different supports, and we can help you talk about those and guide you. But once you have gotten approved for a waiver and your case manager hands you a piece of paper, they're going to give you a piece of paper with all the PASA, provider approved service agencies, in your region. And we are one of those. CenterPoint Support Living is a PASA in Colorado, in the Denver Tri-County region. So we provide services in Douglas County, Arapahoe, and beyond. Now we want to, they'll give you that list, and there's probably 40 something providers on there, and it's difficult to know who to go to. And that's why people provide, PASAs like us provide educational sessions to let you know what makes us different and see if you would want to connect to us as an organization. And for you get to choose who's going to be your PASA to walk this journey with you. And you want to make sure it's a good fit, that it's personalized to your needs. So once you have made the decision on which PASA you're going to go with, whether that's CenterPoint Support Living or it's some other PASA, you're going to go back to your case manager and you're going to say, this is who I want to work with. We'll guide you on that. We'll talk to you. We'll help you with that as well. So you would talk with us and we would help you. We would talk to you about what your needs are, see if we're a good fit, and you can decide if you want to work with us. Once you do, you go back to your case manager and say, we want to work with CenterPoint Support Living. They then assign your case to CenterPoint, and then we can help you navigate the Medicaid system. We're going to help you with the billing, to help you with tracking case notes. When you're doing job coaching and mentoring at home, then we are going to help you, show you how to do those as billable hours. We're going to help process room and board payments for you from Medicaid, and we're going to help you operate within the system. We're part of your bigger treatment team. We're also going to help you problem solve challenging situations. You know, I mentioned that there can be, somebody can have a high severity depending on their behaviors. So let's talk a minute about behaviors, because if you're considering becoming a host home provider, you need to know that it comes with its bonus, it comes with beautiful blessings, and it comes with challenges. So a host home provider opens their home and welcomes this individual into their family. And I'm going to go back to behaviors in a minute. I apologize for jumping, but we'll go back there. But a host home provider has gone through the process of getting approved. They're over 21 years old. They have a very clean criminal background check, and they go through some training to get approval. It is a process to get this. You're now considered an independent contractor that's paid by Medicaid. Okay, we help handle the billing and help teach you how to process write down your notes. The individual, again, is going to become part of your family in essence. It's somewhat like foster care. You are their host home for as long as you and they choose to do. Now, we want people who are going to be committed, who have a heart for service, who have a desire to serve. And we want them to go in with their eyes open, that this is something that is a blessing and beautiful and can be challenging. You're going to include people in your family dinners. You're going to include them going to the church and to your social groups. Maybe they'll go on vacation with you, or maybe you're going to want respite support, which we can help you connect with as well, to be able to go on vacation with just your family and not that individual. We will help you and look into that as well. Now, the things you may be doing as a host home provider is you're making sure that the person has a healthy routine that works with their unique needs and abilities. You're going to make sure that they're keeping up with their hygiene, that they're eating healthy, they're encouraging them to make healthy meal choices, and teaching them life skills, mentoring them in day-to-day living, because we want them to be as independent as possible. And that can range for each individual what they need. Like I said, some may be extremely high functioning and they're out there working. They can maybe take public transportation with some coaching and can get back and forth on their own. Or it's somebody that needs more extensive care, and maybe they would benefit from our day program. We can get up to 24 hours a week in day programming funds, either respite or day programming. We currently provide day programming twice a week on Mondays and Thursdays. As we evolve and get more diversity in our clients, and we expand our offerings, and we discuss what those needs are for providing direct support professionals to be able to carry out activities out in the community. We help them stay engaged. That's what the day program is about, is making sure that they are interacting with their peers and they are out there exploring their communities, that they're engaged in fun, meaningful activities, recreation, sports and recreation as well, entertainment and culture, variety. And then we have an office in Centennial, which is pretty centrally located to most of our clients, that we go and after we go into the community, then we bring them back to the office. We will do an intentional activity focused on specific skills, specific social cues, and then have a great time together, have some free time, and then take them back home. So the day program typically is it's 5 to 6 hours away from home, and then we bring them back. So we help you work out a plan so you are getting some space and time in your life to run around and do the things you need to do and to have some rest. Now, going back to behaviors. So I identify behaviors as communication tools. There is something going on with that individual that they are communicating through these behaviors. Then there's a range of things that can be causing a behavior, and a behavior can be a range. I don't like comparing adults with special needs with children, but in this one instance, I want you to think of an infant crying, because they cannot communicate. An infant, their main form of communication is crying when they have a need. So when they're hungry, they cry. When they're thirsty, they cry. When they're lonely, they cry. When they want to be cuddled, they cry. When they're too sleepy, they cry. So when you think of a behavior, I want you thinking it is the cry. Hello, prophetess. I want you to think about the cry of this individual, that they have a need that needs to be met. So you're the private detective trying to figure out what is going on with this person that they're exhibiting this behavior. It could be spiritual too. I mean, we are mind, body, spiritual beings. So we got to look at the whole person. So it can be, you want to start with as simple as they're exhibiting this behavior. They seem anxious. Maybe they are, they're starting to rock heavily, and they're starting to shake their hands or shake an item, or maybe they are hitting the table, or that maybe they're banging their head on the wall, or they start pacing back and forth. Maybe they have a compulsion and have difficulty controlling themselves when they ravage through food, and they rummage through cabinets. Then that's the way they exhibit behavior. Maybe they have a high risk of elopement, that when they feel anxious, they feel like they got to get away, and they will wander away with no concern for their safety or judgment or communicating with other people. So we have to look at all these behaviors this individual typically exhibits, and work together to figure out solutions and to find out what they might be communicating in that behavior. So again, let's go back to the environment. Pay attention to, okay, I'm seeing this person's foot shake a lot more, or I see their hands going into fists. Their body language is telling me that they're upset, or they have their tone increases, or like I said, they start slamming doors, they start physically, they seem more intense and agitated. You are the private detective to pay attention and think, okay, something's going on with this person. And this can apply to people who have full functioning and are having a mental health crisis, they're having anxiety, or they are just frustrated and angry. So we can learn to try to navigate and think, is this something I can affect? So paying attention. When I notice somebody is not in a neutral zone and they are exhibiting different behaviors, I will start paying attention and thinking, am I anxious? Am I feeling frustrated? Do I need to calm down? Do I need to get into a better space? So I start with me first, and I think about, how am I presenting myself? Am I feeling calm? Then if not, I need to take some deep breaths and relax my body. And personally, me, I will pray also and ask the Lord to help me calm myself and figure out what's going on. So after I've examined myself, I pay attention to my body language. I want to be open. I want my body to be like welcoming. So I'm not going to cross my arms. I'm not going to sit there with an attitude. I'm going to purposefully relax everything. And I'm going to have an open stance, as they call it, where your body is not straight on facing, it's slightly back and open. So I'm going to pay attention to how I'm presenting myself and my tone of voice. And then I'm going to look in the environment. So if I've adjusted that and it's the person still anxious or showing these behaviors, is it cold in here? Is it too hot in here? Is it really noisy in here? What is happening in the environment that could be contributing to this person? Behaviors. Are they feeling overstimulated? Are they needing to step away to a more quiet space to regulate their emotions? They may need help with that and guidance. Sometimes you can ask questions with giving very clear one-word questions, not open-ended, because when people are anxious like that, it's more, let's be more simple with our words. So we're looking at, are you feeling cold right now? Are you uncomfortable? Are you feeling pain right now? Where is that pain? Are you feeling it in your stomach? And a lot of times, if people don't have verbal abilities, there'll be sign language cues like, I need to use do you need to use the bathroom? And you'll learn those cues depending on what's best for that person. And you're going to check in with them and say, okay, let's go on over here. come look at this over here. Let's check this out. I always carry a variety of things on me that are used for calming and regulating emotions. So fidget toys, spinners, I'll bring some stretchy toys. They are sensory items that help to regulate. I also provide, I also always have with me one-on-one calming activities like coloring or blank pieces of notebook paper and pens. So that way they could start coloring or scribbling to get some of those to get their thoughts focused. So there's different interventions that you can use. So get them out of an intensive environment and into a calming one. You're going to pay attention to who's around them. And do other people need to be coached on how to be communicating and how to regulate themselves as well? So those are some, just a couple things, tips as you dive into this is be a private investigator. What is happening in this person? Do they need snacks? Are they staying hydrated? Maybe they need to go for a walk. Maybe they need more sensory interaction at that moment, and they need some pressure on their arms or hugs, depending on the person. So it is about, there's a reason behind the behavior, and let's figure out what's going on with this person. Sometimes they just need to be left alone and given space, and that's part of it as well. Sometimes they're talking so much and asking repetitive, compulsive questions that they trigger other people. So we'd have to work out a plan with your case management team on what's the best way to handle that. I had a client, a kid who I worked with for integrating into day camp programs, and he had a certain number of questions he was allowed to ask. So when he got compulsive repetitive, I would ask for one of his question cards, and if he could, and then each time after that I'd be like, you have how many more question cards? And he'd pull out his question cards and count them, and I'd be like, okay, be careful, do you really want to ask this question right now? And he'd decide if he wanted to hand over a card. So those are some people have communication devices. Some people will need one-on-one support to stand by them because they're unsteady in their balance. And others may have a hard time when they're in stores and they like to just grab on things and tuck them in their pockets. So we may have a plan with you on, let's pull open our pockets and just check them to see if something accidentally got in there. So we will work with you to problem solve some of these behaviors. And some can be very aggressive, but you're going to know that beforehand. We're going to work that out and prepare you for that. So, and sometimes I have been physically assaulted by people where they got physically violent. We don't typically have too many people that we take on and assign to host home providers who have that level of need, because it needs to be a very special person who is well equipped and knows how to handle that and is comfortable handling that. So we're very choosy, and we're going to make sure it's a good fit for you and your family. And there's such a wide range of individuals out there who desperately need a home. They need a family that they can connect with. They need somebody who's going to care about them and see them as an individual. And that's what we strive for. We are not, the owners of our organization, Linda and Terry, are strong believers, and many of our employees have strong faith. We are not a Christian organization. We have a lot of people who have strong faith. So we see that as an important point in making your decision is, what are you looking for? Do you want specific types of people? And we hire a range of people, so that we do not discriminate. We just want you to know that if prayer is something you want, we'll pray with you. If you want other believers to walk beside you, we will do that. We're here with you. We care about you. We'd love to answer your questions. Please reach out to me. If you have any questions, if you want to book a one-to-one meeting to free consultation to talk about what your unique situation is. Or if you want me to come talk to your group, then reach out to me. You can also check out our website, centerpointsl.com. And we have some postings on Facebook, and you can find Terry Williams, the owner, co-founder, on LinkedIn. We are happy to walk this journey with you. God bless you. Love you. And be at peace today. Take care.